जब ये वबा फैले तो हमारी ज़िंदगी में बहुत मुश्किलात थी, डर लगता था, खौफ था। हमारे दायरे ने हमें ये सिखाया कि हाथ धोने हैं, 20 सेकंड तक अपने हाथों को मलें, उनको अच्छी तरह मसल करके फिर धोएं। हमें वो पहनने के लिए शूज़ दिए, हाथों में पहनने के लिए ग्लव्स दिए और मुंह पर लगाने के लिए मास्क दिए। हमारे काम में जब ये हमें सामान मिल गया तो हमारे काम में बहुत फ़र्क पड़ा है। जहाँ पर हम 2 या 3 घंटे काम करते थे खौफ की वजह से, अब वो खौफ ख़त्म हो गया और हम काम दिल लगा कर रहे हैं।
It was great help from UNICEF, great collaboration as well. The staff was, before getting this PPE, was not comfortable to perform their duties, which are essential duties, because we cannot stop water supply even for an hour, what to talk about a day. So it was timely intervention. So all these things actually benefited the citizens at large.
Punjab is Pakistan's most populous province, a land of resilient and hard-working people who, despite challenges, never falter or flinch from their professional duties or obligations. Health indicators were not very good in the Punjab even before COVID-19, and the situation only worsened after it entered the province. Suddenly, health systems were further overburdened, and the need for infection prevention control measures was intensified in order to prevent the disease.
Initially, at the first stage, when we heard about that COVID or Corona is coming towards Pakistan, so then they started preparing. But initially, there was lack of supply of PPE. People were not trained, and people not aware how to tackle this disease in ICUs, in hospitals, in community. So there was a lot of chaos initially.
To ensure the realization of their vision, UNICEF worked to enhance a plethora of different fields, which in turn ensured evidence-based programming along with efficient use of the available limited resources. First and foremost, this meant ensuring hand-washing facilities to create barriers in the spread of COVID-19. As such, UNICEF partnered with the Government of Punjab and the Water and Sanitation Agency to install innovative mobile hand-washing stations fixed on water bowsers and motorcycles. With paddle hand-washing facilities made from recycled drums, ensuring hand hygiene and water conservation. These facilities were placed at strategic points in the city. Securing safe drinking water for the communities affected by COVID-19 was also made a priority. Availability of clean water was essential in promoting proper hand washing with soap and also in providing safe drinking water, thereby contributing towards reducing the risk of infection from COVID-19 and other diarrheal diseases. Similarly, for sanitation, new latrines, including for people with disabilities, were constructed in healthcare facilities to further slow the spread of the disease. Given the rate at which cases were increasing rapidly, UNICEF made use of its existing communication network of social mobilizers, CPRs, motivators, and quickly initiated hygiene promotion sessions. Educating the public on prevention and control practices, religious leaders were also engaged. With support from the Government of Punjab, the Clean and Green Punjab social and digital media platforms were also used to raise awareness within communities, reaching out to over 4.4 million people.
ये तो हमने टीवी से सब कुछ देखा ना। जरासीम से पाक अगर होना है बंदे ने तो सफाई ज़रूरी है। सैनिटाइज़र लगा के बाहर जा रहे हैं, मास्क पहन के बाहर जा रहे हैं, कुछ तो फ़र्क पड़ता है ना इससे।
While keeping the community relatively safe from COVID-19 is certainly a step in the right direction, nothing would be possible without frontline health workers who risk their lives daily to save others. Keeping them in mind, the program supported the training of sanitary and frontline workers, as well as giving them optimal equipment to stay safe. Focusing on sanitary workers is where the program truly shines and stands out as something unique, with a model that can be replicated throughout Pakistan. At one point, COVID-19 seemed like an immovable object for the people of Punjab. But as a new day dawns, innovative measures are being taken. Hospitals are gaining strength, patients are in better hands, and the public can slowly re-enter work. Perhaps finally, the thought of tomorrow isn't as daunting as it once was.
Since the onset of the COVID response, UNICEF worked under the leadership of the Housing, Urban Development and Public Health Engineering Department to bring together different actors in the WASH sector, which is also responsible for infection prevention and control. So this includes now UNICEF, the government department, the WHO, and over 10 civil society organizations. Now, these together have a common strategy, which is the infection prevention and control plus WASH strategy. We have common messages focused on hand washing, sanitizing the hands, and frequent hygiene practices. And so common messages, common strategy, and frequent meetings to plan together.